Hi everyone. After thinking about where you guys were in understanding the cardiovascular diseases, I thought maybe I would go over some anatomy with you guys sort of as it pertains to disease. So on this first heart here, I'm just going to label some of the chambers and areas of the heart that you guys have been reading about in the books that you looked at. So the first one down here, I'm just going to label for you guys the left ventricle, and above it is the left atrium. And up here we have the aorta. On the other side of the heart we have the right ventricle, the right atrium, and we have the vena cava, which comes in both cranially and caudally. So on the right side of the heart we have blood entering the heart, and on the left side of the heart we have blood exiting the heart. And then we have some valves. So I'm going to go ahead and label the different valves that you guys are going to want to know about between these different chambers. So we're going to start on the left side again. Between the left atrium and the left ventricle we have the mitral valve. And then between the left ventricle and going out through the aorta we have the aortic valve. On the right side of the heart, between the right atrium and the right ventricle, we have the tricuspid valve. And between the right ventricle going out to the lungs, we have the pulmonic valve. The next slide will show you guys these written out, but those are the different chambers and parts of the anatomy you're going to want to understand as we talk more about disease in the upcoming slides. So how does blood flow work? You guys read some information on this, but I thought maybe it would help out if I drew it out for you guys too. So this is the exact same heart diagram we just looked at. Remember we talked about that blood was coming in through these vena cavas. First place it's coming into is into the right atrium. It's then going through the tricuspid valve into the right ventricle, out through the pulmonic valve, out to the lungs. Now, on the other side, when the blood's coming back in, it's coming back in from the lungs, going down from the left atrium into the left ventricle, through the mitral valve, and then it's going to be coming out through the aortic valve and out through the aortas, or the aortic arches, and flowing back out to the body. So on this slide, we're going to talk about what goes wrong with the anatomy of the heart that leads to that left-sided heart failure. So I'm just going to draw on some of the blood flow on this one. This one we're just going to be focusing on something wrong with the left side. So the right side is actually functioning just fine. So we're still going to have the blood coming in, vena cavas, traveling through the right side, atrium and ventricle just fine, and out to the lungs in a completely normal fashion. But something goes wrong with the left side of our heart. So as the left side starts to fail, it can be due oftentimes to either a mitral valve disease or something wrong with the aorta where we're getting an aortic stenosis in that aortic valve. So both of these are going to affect how the blood is flowing back out of the heart and into the heart on that left side. So when the left side's failing, that blood is going to end up backing up into the lungs. So if the left side fails, the left side's what's pumping the blood out to the body. If it's failing and it's not getting that blood out to the body, its choice is it backs up into the system. The place the blood came from was the lungs, so it's going to back up into the lungs. So what this can look like as we look in our diagram, we would normally have our blood coming from this left atrium into the left ventricle. That would be happening normally. But if this is failing in here, this blood is going to start going back the incorrect direction. So now we're going to have blood coming in from the lungs, but we're also going to have blood going the wrong way and backing up into the lungs as well. We can also have decreased blood flow coming up through the aortic valve, and we can have decreased blood flow going out to the body. So not quite enough oxygenated blood in the body, too much oxygenated blood in the lungs. Not a good setup for generalized health. So some of the clinical signs we can see with left-sided heart failure all relate to having these issues in the lungs. So we're going to see things like pulmonary congestion, or pulmonary edema. You'll also be hearing crackles in those lungs. You'll have some disturbances in the breathing, so we'll see some dyspnea. You can also hear coughs. And if this gets more severe, they can become cyanotic because of a real decrease of the amount of oxygen that their blood is getting out. And this is what left-sided heart failure will look like in your patients. Now on this side, or on this slide, we're going to talk about the opposite issue. What if the right side of the heart is failing? So with right-sided heart failure, we have the left side functioning normally. You can see I've drawn on our normal left-sided blood flow, but now we have something happening in the right side that's not working. Things that can lead to right-sided heart issues are if we have a stenotic valve at the pulmonic area, so pulmonic stenosis. So that valve's sort of shut down and not allowing blood out to the lungs the way we would like. Heartworm disease also frequently leads to right-sided heart failure. And if left-sided heart failure gets really severe, it can lead to right-sided heart failure. Okay, so we have an issue with the right side. Just like in the left side, we talked about when it started failing, the blood backed up. It didn't have many places to go. So when we're looking at the right side, this blood is coming into the right side from the body. So when we're looking at right-sided heart failure, we're going to have blood backing up into the body. So what this looks like, we're going to have blood that's going to be coming in the vena cavas, be coming into the right atrium down to the right ventricle, but it's also, when this starts to fail, going to be backing up, going in the reverse direction back into that right atrium, and also back out into the body. So we're going to see issues relating to backups in the body of this blood. We can also start to have decreased blood flow going to the lungs. So overall, you can end up with issues relating to that. So some of the clinical signs you're going to see in your patients if they have right-sided heart failure: blood, too much blood in the body, not quite enough going out to the lungs. So you're going to start to see some hepatic and splenic enlargements. Those two organs specifically, because they harbor a lot of blood. They are great storage organs for our blood. So if there's too much blood in the body, the spleen and the liver start to get big. You can also have jugular distensions. So there's too much blood in that body. You can start to actually see that jugular vein and see it pulsating. The jugular vein gets too big. And you can also have some pleural or pericardial effusions, where blood is, or where fluid is accumulating around the heart, which is also going to interfere with how it functions. And that is what right-sided heart failure will look like in your patients. So the last couple cardiac diseases we're going to talk about are dilated cardiomyopathy and hypertrophic cardiomyopathy. This slide is going to go over just the dilated cardiomyopathy. This is the one that was more common in cats. It also occurs in giant breed dogs and Dobermans. It is oftentimes diet associated and often linked in that to a taurine deficiency in their diet. So what this actually looks like is the heart's just getting too big. So instead of having this normal silhouette of the heart is expanding in size. So you have a heart that's out here. So essentially what this looks like, you kind of have a fat and flabby heart, and a flabby heart is not very good for pumping blood and maintaining generalized health. So the last heart disease we're going to talk about is the hypertrophic cardiomyopathy. Again, this one's common in cats, and it's the one that can lead to the saddle thrombi. So there was a cool video on that in the books, hopefully you guys watched, that's going to show you how those clots can definitely form in these vessels, or in these ventricles and atrium. So in this one, what we have is the walls of all of these heart chambers getting thickened. So instead of having nice big heart chambers, we end up with much smaller and constricted heart chambers. So a lot less area for the blood to pump through. Things can get a lot more turbulent in here, and it can lead to clots getting thrown out into the body and those saddle thrombi happening.